part 2 of our knee pain series is what we call kneecap causes or kneecap pain. The technical term is Patellofemoral Syndrome. It's where the kneecap and the femur have some friction in between them and it causes quite a bit of pain. Our kneecap is actually a free-floating bone. It's called a sesamoid. So it free floats in our joint. And a lot of times what happens is that kneecap can start rubbing on the femur, the thigh bone, and we call that patellofemoral syndrome. And that friction that it undergoes wears down the cartilage lining on the kneecap, and you get softening of that cartilage, and that's called chondromalacia. So I'm not trying to talk to you about this in terms of clinical. I want to just explain to you what these terms are, just so that you have some breadth of knowledge on it. So as the kneecap tracks and it hits the femur, it wears down and it's quite painful. The most common one we see is a kneecap that tracks laterally or outwardly, and it hits the outside part of the kneecap. So that kneecap should go right up and down, but it tracks outward, okay? And that's very common because our quads are tight, or also the way our hips are. So if I walk and I walk with my hips rotated inward, I'm going to get more lateral or outside friction of the kneecap, and that can be quite painful. So actually what we do a lot of times in patellofemoral syndrome or kneecap pain is we train the hip. Strengthening the hip muscles and the hip rotator muscles can actually fix or alleviate the kneecap issue. What happens is if we strengthen the outside hip, the knee can sit outward more instead of being knock-kneed, staying out, and the kneecap is generally in better alignment, and there's less friction that's caused from just fixing that one little component. The other thing is we want to control quads, so we do a lot of quadriceps strengthening, or what we call quadriceps control, so that we do a lot of that exercise, and we'll also mobilize the patella as well. But the first thing is we go after the hip. So it's funny that it's a knee problem, but we're strengthening the hip, and it's because of biomechanical principles. We want to control the amount of knee excursion going inward. We want to keep that knee out. We don't want this. So when we're walking up and down stairs, we don't want the knee to be inward. We want to be out here. So, or when we go squat, we don't want this. Okay, we want the knee to be out. Okay, so the hips control that. So that wraps up part 2 of knee pain, or common cause of knee pain will be the patellofemoral syndrome or kneecap issues.